Hello everyone. So today the topic uh, we will make video on is on Kawasaki disease. So as you know, uh, it is seen in children who are below 5 years of age. So it is between 6 months to 5 years of age. It is a vasculitis. What kind of vasculitis? You will answer. Now, leading cause of heart disease in developed countries. It is a leading cause of heart disease in developed countries. Then what is the leading cause of heart disease in the developing countries? You will answer. Now, boys are more affected with girl than compared to girls. 1.5 times more risk with boys, and Japanese and Korean people are more affected in this disease. We know this mnemonic: crash and burn. This is also the criteria to diagnose it. So CRASH, that is conjunctivitis, rash, adenopathy, strawberry tongue, and head and foot changes. And burn is fever. Now, how much fever? Okay, so it should be more than 5 days, and it should be high grade fever. Okay, it should be high grade fever. And what are the hand and foot changes? We see erythema and edema. So there are three phases of it. It's okay. There is an acute phase, subacute phase, and convalescent phase. In the acute phase, we see the erythema and edema. Acute phase is from 1 to 2 weeks. Subacute from 2 to 4 weeks. Convalescent 1 to 2 months. Acute, subacute, convalescent. In the acute phase, we see erythema and edema. In the subacute phase, we see desquamation. Okay. So conjunctivitis, rash, adenopathy, strawberry tongue, and hand and foot changes. Fever. Now, what kind of conjunctivitis it is? It is a bilateral conjunctivitis which is non-exudative. Bilateral, non-exudative. Whereas adenopathy is unilateral. And how much should be? It should be more than 1.5 centimeter. But the one of the lymph node should be 1.5 centimeter से ज़्यादा होना चाहिए. One of them should be more than 1.5 centimeter. So adenopathy unilateral, conjunctivitis is bilateral. Rash is non-vesicular and polymorphous. Non-vesicular and polymorphous rash. What is strawberry tongue? It is basically changes of the oral mucosal changes. So you see the diagnostic criteria. Fever, there is the high grade fever with out of the 5 principal features. The 5 principal features we know: the crash mnemonic. So the crash mnemonics are the 5 principal features, जिसमें से the strawberry tongue comes under oral mucosal changes, because also you have red lips, okay, in the oral mucosal changes. So these 3 phases are there: acute, subacute, and convalescent phase. In the convalescent phase, you have clinical resolution, not laboratory. So lab thinks your CRP, your ESR will be still raised. And important thing to know is that coronary artery aneurysm, okay, this develops in the subacute phase. In the convalescent phase, it may regress or it may persist to happen. Okay, so for this CAA, coronary artery aneurysm, the chances are 50 to 25% if you left the patient untreated. And with treatment, okay, this decreases less than 5% risk. What is the first choice of treatment? IV immunoglobulin. If your IV immunoglobulin fails, then what do you give? You give corticosteroid. If this fails, you give biologicals. So IVIG first. If it fails, then corticosteroid, methylprednisolone, pulse therapy. If that fails, you give biologicals. So what is the treatment? First, IVIG is the first preference to prevent the development of CAA, and this is a single infusion. You give 2 grams per kg, single infusion, effective when given within 10 days. Effective when given within 10 days. And aspirin you give at high doses initially until the fever resolve. At high dose means 30 to 50 mg per kg per day, and at low dose, that is 3 to 5 mg per kg per day, until the CAA resolve, that is antiplatelet therapy. In initially aspirin high dose, it is anti-inflammatory. In the low dose, it is an antiplatelet drug. And IVIG you give as a pulse therapy. Corticosteroid, methylprednisolone you also give as a pulse therapy. Biologicals, infliximab, anakinra, and tocilizumab you give. So that is about the Kawasaki disease. And yes, it is a medium vessel vasculitis. I hope you could have answered it. Medium, and leading cause of death in developing countries with heart disease, rheumatic heart disease. Okay, thank you.